Dr. Asteria Taylor Miller, and I am the Chief of Engagement and Diversity, Inclusion, Equity Officer for the Root Cause. And I'm so glad to be here at the Lunch and Learn here at the Fraser House. And today I'll be presenting to you diabetes and heart disease and how to lower your risk. Do either of you have diabetes? I know you said you have pre-diabetes.
Also
Pre-diabetes. This is a good place for you to be, because right now you're kind of teeter-tottering, and it's a good position for you to, you can roll those numbers back and just take little small steps. And it doesn't have to be difficult, that's why a lot of people, they get nervous, and sometimes they get overwhelmed when they find out they have it, because a lot of them present in the emergency room when they actually have it. So you're in a good place. So I'm glad you're here.
My number is kind of like his.
I'm sorry?
My number is kind of like his. It's kind of like
Yeah, borderline.
5.6 and 5.8 for the last 5-6 years.
That's great. You're doing the right thing.
Go back that way.
Yeah. Do you exercise?
Yeah.
Great.
4 days a week.
That's great. That is good. Well, that's okay. You got one day, you can take a break, So this is good. This is good. So this presentation was designed by the Texas A&M Health Center for Population Health and Aging. And it's been supported by the American Diabetes Association, Connected for Life. And so it's called Your Diabetes, Your Heart. My objective is for you to learn, after you have seen this presentation, understand what diabetes is, know about its link to heart disease and stroke, understand how to take care and take charge and reduce your health risks, and also to join No Diabetes by Heart initiative. Now, Christina has a story. Christina has diabetes, but she's at one time might have felt hopeless, but she's no longer hopeless anymore. So let's just take a listen to her story.
I'm Christina, and I'm living with type 2 diabetes and high cholesterol. I survived a triple bypass heart surgery. My high school friends wanted me to always be there, so I got motivated and I addressed my family history. Now I manage what I eat, and I'm training for my next 10K. One day at a time, one victory at a time. And she was there for me.
Manage the link between diabetes, heart disease, and stroke. NoDiabetesByHeart.org.
And just as Christina, you heard her story, she said she had a triple bypass. And oftentimes people find themselves, especially when they have diabetes, they find out they have heart disease. And that is one of the, one of the things that have complications that can happen when you have diabetes. Stroke, you can have kidney disease, and heart disease, high cholesterol, all of that goes together. And so what we would like for you to know through the American Diabetes Association and Texas A&M Population Health for Aging is that you can be empowered. Even though you may have type 2 diabetes or pre-diabetes, you need to understand that there is a known risk, especially for people of color. And so you can do something about this. There's a link here, NoDiabetesByHeart.org, and you can go there and find out a lot of different resources and information. A lot of it is in your packet that I've given to you today. Now, understanding diabetes. Does anybody know what it is?
I think it's when your body makes too much sugar or makes too much glucose. Either make it too little or too less.
Mm-hmm.
I can't remember which one it is.
Right, right. That's what it is. It's your insulin. Your body makes and uses insulin. And it's a hormone that keeps your blood sugar in the normal range. But when when your body doesn't make enough insulin, or it can't use the insulin efficiently, that's when you start to have highs and lows. And that's when the insulin that you have it's not sufficient. So many times people have to get on insulin medication, but sometimes people just have to get on the metformin, a pill or something like that, and they can manage it. I had a family member that thought, oh, I'm just on the pill and I don't like the way it makes me feel, and I get constipated, so I'm not going to take it. Well, they stopped taking it and went into DKA, and that's where it's diabetic ketoacidosis, and that's when you go into the ICU. And he was in the ICU for about 4 days because they had to regulate his blood sugar. His blood sugar was like 6. Went up to DKA, diabetic ketoacidosis.
Okay, is it what people in our community call diabetic coma?
Yes, diabetic coma. That's what they will call it.
Yeah,
They sure do. Yes, yes. Hello.
How do you do?
I'm fine. Please take in information.
They're taking the tour.
Okay.
This is one of our lunch and learn presenters. Thank you so much for coming.
Hello. Yes, diabetic coma. That's what we'll call it, you know. And it doesn't have to happen like that. You know, it can be avoided. Just those little small steps. Maybe taking the medication, talking to your doctor. It's so important to talk to your doctor about the things that are happening to your body. A lot of times people feel like they can't say anything. And you can. You should be able to say something. It's your body. But it's your diabetes. It's you taking control of your diabetes. So just understanding how the body works. A lot of people think, well, I can't eat anything sweet. I can't eat I have to stop completely eating desserts, and that's not necessarily true. You have to limit it, and you have to manage, because it's not just sweets that can cause you to have problems. These are the types of diabetes. Now, type 1 diabetes is about 5 to 10% of the cases that you'll see, that where the body doesn't produce enough insulin, and we see more type 2 diabetes than we do type 1. Type 1, you have to have insulin. You are insulin dependent, and you have to have it. The doctor has to give it to you, give you that medication. Type 2 diabetes is the one that people say my blood sugar is high, and so typically that's what it's called in certain cultures. And this is where your body produces insulin but doesn't produce enough, or it doesn't manage it well. So you might have some, but it doesn't manage it necessarily well. And diabetes in pregnancy, that's what that's when you're pregnant and your insulin levels are unbalanced and out of range. And if about 50 to 60% of the women who do have gestational diabetes, that's what it's called, diabetes in pregnancy, they will develop diabetes. If not, if they don't control their eating habits, typically they will develop it at least 3 months after they have the baby. So you have to watch that as well. But type 2 diabetes is its own pandemic. We talk about this pandemic that we're in right now. It's all over the world. everybody's that gets type 2 diabetes, they start to have complications if it's not managed well. And that's when, you know, you start to have problems with your heart, you have problems with your feet, you have problems with your eyes. I know someone who had a stroke in their eye because they weren't managing their diabetes. And then, you know, hypertension, high blood pressure, that goes along with it as well. Now, a couple of talked about pre-diabetes, and that's the stage that you're in. Pre-diabetes is when your blood sugar levels are higher than normal, but it's not high enough yet to be diagnosed as type 2 diabetes. Lifestyle changes can help you with pre-diabetes and reverse the diabetes from you getting the full-blown diabetes. So this is the good news, is that you can do some reversal methods. There's just little steps that you can take. Exercise, eating properly, not eating too much. Sometimes some people, they'll have little small meals throughout the day to manage their blood sugar levels. Also monitoring. It's so important that you monitor. How many of you that do have pre-diabetes, how many of you monitor? Do you have a glucometer?
Do you mind what you eat?
A glucometer?
Oh, no.
You don't have one? You don't check your blood sugar?
No,
Mr. Ron, do you check your blood sugar?
Do I what?
Do you check your blood sugar?
I was trying to find that A1C so you could see all these.
Oh, you have your My Chart?
Yeah.
Oh, that's great. That's great. That's being
but
proactive.
It's not telling me anything right
It's
now.
not telling you about your number?
Hemoglobin A1C.
Uh-huh.
What is the term hemoglobin?
That's the blood. Uh-huh. And it's just telling you your A1C. Your A1C is a average of your blood glucose levels for a 3-month period. So that's the average.
It's not showing me the range.
It's not telling you, well, does it give you a number?
It gives you a number.
It's not pulling up anything.
Which
It
one you
may in
have?
a moment.
Are you with Baylor, UT Southwestern? Which one you have? Who's your provider on my chart?
THR, Texas Health Resources, or
But that don't really matter.
Well,
Yeah.
My chart is gonna show him, I think it might need to kick in, or it might need to go to.
and you might need to go to test
page.
results.
Yeah. Go to a different.
Yeah,
page.
test results will often show you that. And so lifestyle changes, as I was saying, pre-diabetes, you can make those changes, those little small steps, and reverse
Yeah.
those
absolutely.
numbers.
Reverse.
Yes.
Over and over just by diet.
Yes, yes,
Stress, stop worrying
yes.
about your kids.
That's it. That's
Stress,
it. You just
I
said it.
see people changing their stress level.
Yes. And how do we change our stress level? We exercise.
It's one of
We
them.
can meditate. Whatever faith that you're in, you know, if you know the Lord, you can pray. You can have prayer partners. Reading, you know, you can do that. And a lot of times people just have music. They just play music, you know, just to be able to, you know, just allow the stress, and then just to just move away, you know. And then too, meditation, you know, and I say meditate on the Word of God, you know, and have those positive affirmations that are going around, you know, because we do typically these days, because of this pandemic and where we are, especially with the variant, you know, where it is, many people are uncomfortable. They are stressed, and they just don't feel good. And it's a valid feeling, you know, because we are in a position that we've never ever been in before, and everybody's trying to figure it out. Now, some people are at higher risk, and many of you probably knew this. You're more likely to develop type 2 diabetes if you're Hispanic, and they are about 11% in the population. Black or African Americans, about 9%. American Indian is about 15% likely to get it. Asian and Pacific Islander, those are even higher, I believe, than the American Indian. I don't remember that number particularly, but all of these cultures and people of color are more likely to be predisposed to diabetes and those comorbid conditions that arise. And those comorbid conditions are usually what cause the complications that we have, the amputations, going on dialysis, all of that. You're also more likely to develop type 2 diabetes if a family member, if you have a history of it in your family, diagnosed with diabetes when you were pregnant, not getting enough exercise, being overweight or obese, over the age of 45. So age is a predisposition to diabetes, and we can't change aging, but we can change our quality of life as we age. Now, let's understand the link between diabetes and heart disease. Now, living a longer, healthier life with type 2 diabetes starts by knowing the link to diabetes and heart disease. People with diabetes have a higher risk of heart disease when diabetes isn't managed. It can damage your blood vessels. So when you're going through those peaks and lows and you're not staying in range, because usually if you monitor, you'll want to stay between 90 and 150, 140, that range. It depends on what your doctor says as well, because some people may be predisposed to being lower at a 90. So 90, you may start to feel shaky and all the, you might start to get dizzy and all of that stuff. Your blood sugar does.
Oh, your blood sugar.
Your blood sugar.
Okay.
Now,
LDL.
that LDL is dealing with the blood vessels.
Right.
And that's what you're looking at, that's the bad cholesterol. And that's what we want to look at, is that's the link to heart disease. So if your blood vessels are damaged due to you not managing your diabetes, then that's what can lead to heart disease. So that's why it's so important to manage that. Make sure that you're eating the right foods and you're reading the labels. These days, many people aren't going out to eat because of the pandemic. So we are, deciding to cook from home. And we have a food list here for you all who are interested. And anybody who is watching on YouTube or Facebook, if you'd like to get a book, the books will be here, and the folders about your diabetes, your heart, will also be here at the Fraser House. Now, understanding the link again, the most common cause of heart disease is the buildup of cholesterol in the arteries that supply the heart with blood. The buildup of plaque can clog your arteries, leading to a heart attack, a stroke, or heart failure. Now, how many of you know someone who's had a heart attack?
Because of my family.
And how many of you know someone that maybe that same person who has diabetes? They didn't have diabetes. Well, oftentimes it can lead to stroke, heart attack, or heart failure. That's the number one complication with diabetes. Now, there are other things like high blood pressure, neuropathy, kidney disease. Those are also issues that can come up, with diabetes. But this is the number one, and it can be managed. You can change it, and it's just one step at a time and one household at a time. I say when I have diabetes, the whole house has diabetes. if I have it. And I don't have it, thank God, right now. It's in my family. But I treat my family as if, you know, we're going to eat healthy. We're not going to do this. We're not going to do that, you know. And so it just makes it just makes such a difference. And then till you feel better, you know, you're able to move like you need to move. And this slide says that people living with type 2 diabetes often have lifestyle risk factors. And we just talked about that, the high blood pressure, unhealthy levels of cholesterol, obesity, and a lack of physical activity. A lot of times if you can just get out and just walk a block or two, it just helps you to breathe better, it helps your mind, it helps your body, because it's just like, you know, when you know, if you got a car that's sit there, brand new car, it probably sat there all those years, and it's hard to crank. It's hard to get to moving. You know, you've got to have everything in order and up to date to make sure that you know, everything is running properly. And you'll see this lady here, she's being proactive and talking to her doctor. And your doctor can give you all kinds of information about how to stay healthy. And you just take the initiative to want to empower yourself to do it. And that's what it is. A lot of times people have family members and they do not want to manage their own diabetes. And they try to manage it for them. And you can't do it. You can do that for so long, and then eventually it plays out. That person just, you know, won't take control. So let's listen and see what this celebrity has to say about type 2 diabetes.
You've been diagnosed with type 2 diabetes. You have to carefully monitor your health for the rest of your life, and you have an increased risk of developing cardiovascular disease.
Type 2, take 2.
You've been diagnosed with a new purpose: to fight for the amazing life you've made for yourself, to look that risk of heart disease square in the face and say, no, not me. You've been given a new opportunity to live. Get started at NoDiabetesByHeart.org.
And I believe that was Angela Bassett. Yes. And she's a beautiful lady.
All right.
And it's so important, just like she said, you have to take charge. It's up to you to do it. And if you want to live longer, you know, and healthier, and typically more people are living longer, and we are having to go to the doctors a little bit more, and these are the things that we have to do to help us take charge. And it's always good to have a buddy. You know, the Bible talks about when two walk, you know, and one falls down, then the other one should be there to pick them up. So I have somebody I talk to and chat with about my eating habits, or sometimes if I fall off or she falls off or whatever, we just kind of empower each other and talk to each other about, you know, let's get back on it, you know, let's do this, or what's going on at the time, you know, because there may be some stress going on, you know, children, parents, work, you know, just everyday life, you know, you just need to have somebody that you can talk to and you can trust, and so that's very important. Number one, you can talk to your healthcare provider, and that'll help you reduce your risk for heart disease and stroke. Talk to them about this presentation and let them know that you have found out some new information if this is new to you, and ask them to give you some tips. And you'll also find that in our documentation that you have in the folder. You can make lifestyle changes. Follow a heart-healthy diet, reaching and maintaining a healthy weight. Now, weight loss is more difficult as we age, and we know that. So you didn't put on 20 pounds in 2 days. So don't think that you're gonna go and do this crash diet and it's gonna probably bring your blood sugar down way low, and you'll be trying to figure out, what am I doing, where am I, because your blood sugar is so low, you're walking around like in a drunk stupor. So if you didn't put it on in 2 days, you can't take it off in 2 days. What you do is you manage it over time. It's consistency. It's obedience and discipline. That's what I say. Because when you start to think of it as being obedient, that obedience leads to health, life, and freedom. And if you want health, life, and freedom, you'll be obedient. You'll be disciplined. You'll take those little steps. Now, I'm not going to say we're going to do it perfect, because we don't. Nobody does it perfect. But just to get back up and say, I fell off that time, let me get back on it, and I'll keep going. Just keep going. Just keep going. And then you're going to find yourself and you're going to be like, wow, she noticed that I lost weight, or have I really lost weight? Or man, I put on my clothes and they look a little big on me. I have a patient right now. She's a member that's a participant in our program. She has lost weight. Her pants are falling off of her when she does her yard work. So she's having to get some more clothes. She's happy about it because she feels better. She didn't know she was even feeling bad when she found out she had diabetes. If you smoke, please find a way to stop. That leads to a whole lot of other issues, and I know a lot of people smoke because that's how they manage their stress. But there are other ways to manage stress, and that being physically active, I can tell you, when you start being more physically active, your numbers will change. And the only way you'll know that your numbers are changing is when you monitor. You have to know what your blood pressure is. You need to know what your A1C is. You need to know how much you weigh. And I'm not saying get so, just so focused on it that it makes you nervous. Get that number, put it away, and then in the next 2 weeks, check that weight again. But if you are pre-diabetic or you have type 2 diabetes, you should be monitoring every day, at least when you get up in the morning. You need to know where you're starting, what your number is. And then when you go to the doctor, you can say, well, this is what my blood sugar has been running. And then also, that night before can affect that next morning. So there may be some changes that you need to make, because if it's low at night, you might need to have a little peanut butter and a graham cracker. You have a question, sir?
Well, no, I'm getting,
Okay.
I'm sorry.
Okay.
I'm the survey.
Oh, okay.
I'll wait till you get to that point.
Okay. And I was just talking to you about monitoring, keep track of your blood glucose levels and your cholesterol and your weight and your blood pressure. Just have a little booklet that you have right there, and you keep your numbers there. And once you start to see your own numbers, you can start to manage yourself a lot better. You won't have to go to the doctor, the hospital, and say, well, I don't know what happened, I don't know, I'm not feeling good, or I haven't been feeling good for several days. And there may be things that you can do to just, to curtail that right then and there, because you know what your numbers are. And take your medications as prescribed. I know people who will get their medication and then they'll say, well, I just didn't feel like doing it, I just, I'm feeling better now. Well, you may be feeling better because you were taking your medications on time and taking them as prescribed. Now, oftentimes, a lot of people who just stop taking the medications because they're feeling okay and they think it's okay. It's all right for them to stop taking the medications, and it's not when it comes to especially diabetes. Now, you can ask your doctor these questions. What changes can I make to take care of my heart? That's if I have diabetes or pre-diabetes. What can I do before my next appointment? If there's something that they want you to do. I do know that, if you're not monitoring, you should. And how will I know if the changes I've made are making a difference? You can know that by looking at your numbers every day. And what resources can help me learn more? The resources that I've given you today are just the start. And once you go see your medical provider, you can definitely get more information. So I have some questions for you about diabetes and heart disease. Question 1. Seeing your doctor regularly can help you manage your diabetes. Do you think it's true or false?
True.
Let's see. That's right, it's true. Yes, seeing your doctor regularly can help you manage your diabetes. Question 2. People with diabetes are 2 times more likely to develop complications from heart disease. True?
True.
Okay. You're right again. It is true. People with diabetes are 2 times more likely to develop complications from heart disease. And that's a number that you should remember. 2 times more likely. Managing your diabetes can be stressful. Is that true or false?
True.
Why do you think so?
Because it's work to be done, and sometimes we don't want to change our diets. It's
Mhm.
just work.
Yeah.
And it's unknown.
Yes. Yes.
I mean, it's
Unknown, sometimes I hear people say the unknown is fearful.
yeah, they're in fear. Will this
Mhm.
work? Or
Mhm.
and it's out of the box.
Yes.
We can't do like others.
Mm-hmm.
We can't, and so when we can't go to at a function, we can't do like others. It's stressful not to eat
What somebody else is eating.
especially when you're an emotional eater.
Right, right. And that's where managing your stress comes in the most. You really, really need to do some things to help you with managing your stress. And there's nothing wrong with being able to manage that stress by going and seeing somebody, sitting down, talking to somebody who's a professional. I know sometimes in certain cultures we, have a stigma about that, and it shouldn't be. It should not be a stigma on that, because we, our bodies were made, and if you believe in God like I do, God made our bodies, but we still are flawed because of sin. And our physical can change. My physical is not like your physical. And so my brain may not function like yours. And so somebody who's a professional, I believe who God has given us the education and things that we need to go. And sometimes you can't even tell people where you're going. Just go. Take care of yourself.
Stereo, what I heard, what helped me and other people that was in that class years ago is that God uses people.
Yes, it does.
So when I go, God, yeah, I said, but God uses people and they get degrees.
Mhm.
So God uses people to help us.
That's so true.
Because God
That's
already
true.
did his part.
Yes. Like we said, if you do have a faith in God, there were 2 things that Christ said to do: love God and love others. And if we're on our job at loving Him, we can learn how to love each other. Even though some of us have some very difficult personalities and temperaments and all of that, we have to be patient with one another, and kind to one another, and giving space, respecting one another. We do that, we can heal our land. We truly can. We could heal our land. My next question, almost the last one. I can never eat anything with any sugar in it, ever again. What you think, Mr. Ron?
I don't know.
You want let's see. That is false. Yes, you can. You can have something with sugar in it, but it has to be in moderation. In moderation. We have to do everything in moderation, or else we go overboard. And when you go overboard, it's too much. It's too much. Everybody just needs just enough. I know when the Israelites were in the wilderness, God rained down, He allowed them to have manna, He allowed them to have water, and it was just enough for every day. Every day, just your daily ration. You don't need to have enough for yesterday, today, next week, next month, all in one day. And a lot of times people will do that, but just like you said, people with stress. My last question. Adding some movement to your day is a way to take care of your diabetes and your heart. True. And how can we add it? Gardening, mowing the lawn if you feel like it, taking a walk in the park, go to a Walmart and just walk around if you feel like it. Go to the mall if you can, if you feel safe. Just go somewhere where you feel safe, because we are still in a pandemic. And even at home, sometimes people will put on the YouTube and they'll find some music, and 20 minutes, just move. You can do that. You can sit up in your chair and sit down, So this is true. Adding some movement to your day is a way to take care of your diabetes and your heart. And you can win this fight, because it is a fight. It's a fight, when we have to decide and make clear-cut changes, because oftentimes we won't decide to do it when we can do it, when it's not going to be as hard. When you start having complications and you're having to go back and forth to the hospital, getting more medications and more routine visits, which cost more money, and the food and all of that stuff. So we don't want you to be stressed about that. What are the pros and cons to consider making a health goal? Now, do you know what a health goal is?
Maybe losing weight, or a goal to get your weight down, or a goal to eat properly.
Now that's good, but we want to zero in just a little bit more. A health goal could be, I'm going to get up and I will eat a small bowl of cereal, and no less than 3 carbs, 5 carbs within my meal in the morning. Something specific. Or I'm going to walk 20 minutes for the next 30 days or the next 10 days, and to lower my blood pressure, to lower my risk of heart disease. Those little specific goals, something that you know you can do, and you can attain it, and you can do it over time, because that repetition makes a difference. It really makes a difference. And the pros and cons could be, well, what is the pro? What's the good thing about making a goal?
At the end, when you achieve it,
that's it. It's like,
it
yes.
your endorphins and stuff.
Yes.
And when you feel better, you do better.
Yes. And it also feels good when somebody else notices, or if you just start to feel better.
Yeah,
well, and what's the negative side of making a health goal? What do you think?
I've had some hard lessons, I guess. I didn't realize that I was fine, and my blood sugar level went down. I didn't know anything about it. You learn these things as you get older. I've been flying all my life, and all of a sudden I'm out on the plane trying to figure out what caused this.
Yes.
So the flight attendant said, "Miss Ron, have you had anything to eat this morning?" No. I don't like to use those little bitty bathrooms on the airplane.
Mm-hmm.
So he said, if you coming down from 37,000 feet, it has a tendency to cause your blood sugar level to drop.
Yes.
So he said, you're going to have to start eat a sandwich, and I've been where I had escaped that is I don't go anywhere except on Southwest, where they were giving,
Yeah, the
they'd always give you
peanuts and all
cranberry
that
juice
stuff,
and
yeah.
peanuts or
Mhm.
something like that, but with the pandemic,
They
they cut
stopped
that
doing
out.
all of that, yes.
So I didn't have the cranberry juice or anything.
Ah,
And
blame it on
I found that
Southwest.
out tomorrow. I'm going, what
Yes.
the hell's going on?
Yes.
I've never had this to happen.
Exactly.
before.
Your blood sugar, your body was telling you, I need some more energy.
So when you
I
get,
need some,
when
some
you get
more.
where I am, all the old folk, you call them and say, hey, what's the deal? And I called a friend of mine, and he said, didn't you ever take some kids somewhere flying? The first thing you're supposed to do is tell them, to give them something sweet.
Yeah, give them a little
Give them some peppermint, jelly beans,
yeah,
or something.
snack.
No,
Yeah, or in cases like that, you might have just a half a Coke or something like that just to bring it back up. But peanut butter is always good because it'll level it out. Candy, peppermint, that can bring it up, but you will have to get you a little small meal, pretty quick because that peppermint wears off.
Yeah.
Yes, and it drops, yes. That peanut butter, it will help you with the little graham cracker. It's just enough to allow you to maintain until you can get, an actual meal. But yes, sir, it does happen. And that's like a hypoglycemic event that happened to you. And those can even be worse because it's so hard to come back from it because you get tired, you get shaky, you're just not feeling good, and it'll wear you out.
Again, I have never had that.
Now that you know, you can do better.
My problem is coming back. I've lost 26 pounds, which put me around 180.
Uh-huh.
Most I've ever weighed was 230, and that was 48, 50 years ago.
Right.
And so I gotta eat right, and now what I have been doing is not eating in a timely fashion, and eating Bluebell ice cream for my 10 o'clock snack.
Oh, I know somebody.